I had a little bit of a difficult pregnancy with Brianna. I have a blood disorder to where I have to take blood thinners as a precaution of my blood clotting. And so to go through the struggle and to finally be able to, see her when she's born was a huge relief. When she was born, we didn't get to enjoy that moment so much.
She was actually born with a bump on her back, kind of like half of a baseball. I didn't know what was going on.
We didn't get to see her for a while. It was really scary.
Within hours of being born, Brianna went through several studies, including x-rays, MRIs, and blood work. She was quickly diagnosed with a very rare combination of vascular malformations.
We call them lymphangiomas and hemangiomas. Sometimes we can treat hemangiomas with medications, but in this case it was not just hemangiomas. She also had lymphangiomas, which is bags of fluids that are containing lymphatic fluid, okay? And they are not treated with medications. I mean, they will not respond.
These things can be very dangerous. They get bigger as the child grows, and they can sometimes clot and bleed, and they can cause pain. If they get bigger, they can push on things, of course, if they're near vital objects, like if they're near the eye or the breathing tube, or in Brianna's case, it went into the space around the spinal cord.
Brianna needed immediate medical attention to keep the malformation from pushing on her spine, leaving her paralyzed and producing serious heart and lung complications.
You can see her spinal curvature a little bit, but yeah, this is her spinal cord, and this is the malformation going in the canal, pushing on the cord, and then all of this is the abnormal veins, all this white area. Should look like all these normal muscles here. See, these dark areas are normal muscles, okay? And it should look like, see this dark area on this side? It should all look like that. But on the right side, okay, if I show you this image, okay, these are the normal muscles on the right side, here's the abnormal on the left. It's huge.
Because of the size of the lesion, it could not be surgically removed.
The way we treat them is we don't do an operation. There's no big incision. Of course, that would be a big bloody operation, and then you can't get all of it out anyway, and then you destroy the muscles. So that's not the right way to go. What we do is we actually put small needles into different parts of the abnormal veins. Once we make sure we're inside a vein, not on the outside, and then we inject alcohol, pure 200 proof alcohol. What we want the medicine to do is clot off the vein. Clot it off and eventually turn into scar tissue from the inside without anything on the outside of the vein, because we don't want to damage the normal muscle on the outside, right? Now, if that stays in the vein, right there, no problem. If it gets into her system, it can stop the heart.
Brianna received her first procedure at the age of 3 months. Now 6 years old, she has received 8 procedures, 5 of them at El Paso Children's Hospital. El Paso Children's is the only hospital in El Paso that offers board-certified pediatric interventional radiologists, pediatric oncologists, pediatric anesthesiologists, and a team of pediatric nurses and caregivers. A full team that give Brianna a strong chance to fight and win against this condition.
And they have been getting smaller and smaller with time. It's a long process. So this has to be done as a team effort, okay? And not only Dr. Moorthy doing the injections, but also, making sure that Brianna was not going to have complications from it.
So thank God we were able to treat the vein malformation that was in the spinal canal, get it away from the spinal cord, shrink it, and then treat the pain and complications, and pretty much got her back to normal. There's still more to do. There's still more venous abnormality. It's big enough that we have to do more sessions, but luckily we can do it here.
We feel really secure with the El Paso Children's Hospital, and so we're glad that this was something that was able to be brought into El Paso, and we really looked forward to it when it was brought here, and when it opened, and when we were told that we were going to be switching over and that our doctors would be there, we were relieved.
Every time Brianna goes to the hospital, she brings a companion, a stuffed pig that has been with her since she was 8 months old. Brianna and Piggy stay together when she receives CAT scans and MRIs.
This Piggy has been with her since She was about 8 months old. And so every hospital stay, he comes along as well. He's in our wedding pictures. So he's part of the family. This is my other child almost. We've almost lost him a couple of times, and we have to find him because they don't make these anymore. And so we always make sure to take very good care of Piggy, and this is her beloved companion.
Although Brianna's bump is still there, it is not noticeable, and it is no longer endangering her spinal cord. She will still need more procedures in order for her to have a normal life. Fortunately for Brianna, there is El Paso Children's Hospital.
Specialized care. That's what it means. We're a big city. We have lots of kids with specialized problems and we have a choice. We can keep putting the stress on families to go out of town, take time off of work, live in a hotel, go to a new place where they don't know anybody, where they have no family support, and try to get treatment for their kids. Or we can support our hospital and keep the subspecialists here so we can keep these families together, keep their support system together. And so in other words, instead of taking our kids to other towns, bring the doctors here. That's the key.
Thank you, Dr. Moorthy and Dr. Carcamo.